Persistent white discharge PB. I'm Dr. Neeraja, fertility specialist from Hyderabad. So many patients will complain about persistent white discharge. We'll see the causes. So, what are all the tests which are advised and what is the treatment we'll see now. So, what are the causes for persistent white discharge? Some people, even if you give antibiotics, so many courses, they'll complain still white discharge. So, the causes are it's physiological. So, when you examine the uterus, cervix, when you do scan, everything will be normal. So, it's physiological. And for some patients, like low socioeconomic status and malnourished and developing countries, due to unhygienic practices, they'll complain persistent white discharge. This is another reason. And one more reason is diabetic patients where there is less immunity, more chance of bacterial infection, more chance of fungal infection. They have continuous white discharge. Another reason is infections. Infection may be in the vagina or cervix, maybe cervicitis or any growth or any polyps near the cervix or any cancerous growth or any type of infection like cervicitis that also causes persistent white discharge. Or problem in the uterus, the endometrium, the infection, endometritis, or any growth, polyps, cancerous growth, or fibroids, even they cause persistent white discharge. And some people they'll forget about pessary. So retained pessary or retained tampon, any retained foreign body in your uterus, it's like foreign body. So the uterus reacts in such a way that it will produce persistent white discharge. So these are all common causes. And one more important cause in low socioeconomic status group is PID, pelvic inflammatory disease. They'll have infection surrounding uterus and tissues surrounding the uterus, around cervix. They'll have infection. It's called PID, pelvic inflammatory disease. Those people also they will complain persistent white discharge. When you see the patient, just first we need to examine the patient. For speculum examination, we need to see the cervix, we need to see the uterus, vagina, and we have to do scanning. So scanning, you should diagnose. You can diagnose any polyps, any cancers, or any type of infection. You can diagnose retained pessary, retained tampon. You can see and you can examine. You can diagnose. Or at the same time, we need to take samples like pap smear from the cervix to know the type of infection, and one swab from the vagina to know the type of infection, or any endometrial biopsy for bacterial infection, or any biopsy from the any suspicious growth. So at the same time, we need to take urine culture and sensitivity, and we need to take blood samples like complete blood picture, sugar profile, everything we need to, and CRP that shows infection. So everything you need to take from the patient. And what is the treatment? When you see the treatment, these people, they need long course of antibiotics. Generally, they need 3 to 6 months course of antibiotics along with vaginal pessaries. We should improve the diet. If there's any suspicious growth, we need to remove and we need to send for biopsy. And any polyps or any infection, we need to give long course of antibiotics for 3 to 6 months. With all these modalities, we can control this type of infections. Thank you.